Greetings, Professor Tammy here. Let's go over week 1, critical thinking. Critical thinking means drawing conclusions after exploring multiple perspectives and evaluating evidence. Critical thinking does not mean developing a strong argument for one side of a debate. Critical thinking does not mean being able to easily recall facts. Critical thinking helps improve decision making, enhances problem solving ability, helps you refine your research skills, polishes your creativity, and stimulates curiosity. Critical thinking is the ability to find, evaluate, organize, use, and communicate information in all its various formats, most notably in situations requiring decision-making, problem-solving, or the acquisition of knowledge. While you are on your journey to achieve your dream career, you should be critically thinking about the knowledge that you are exposed to. Always consider many options. Do not limit yourself by comparing and contrasting two options. Do not rely on instinct. Your mind is like a parachute. It only works if it is open. Critical thinking is not repeating opinions you've heard, especially on social media. Critical thinking is not listening. Critical thinking is not memorizing. Critical thinking is not defining. Critical thinking is scrutinizing facts, questioning assumptions, considering various perspectives. I've included a couple of tools to help you differentiate between thinking and critical thinking. You can refer to Bloom's taxonomy, which is a hierarchy from low to high, very little thinking involved. The higher you go, the more thinking involved. That last one there, remember, you're not really thinking at all. What about understanding? Is that thinking or critical thinking? Apply yourself. How would you differentiate thinking versus critical thinking using Bloom's taxonomy? To piggyback off of Bloom's taxonomy, you can also differentiate between active learning and passive learning. Which activities promote critical thinking and which activities promote thinking? Again, you want to be a critical thinker. Just thinking isn't going to get you where you need to go, okay? So active learning, active engagement and participation, interaction through discussions, problem solving, or activities, encourages critical thinking and practical application, enhances long-term retention and deep understanding, often involves collaboration and peer learning. Passive learning is just kind of like sitting there and being told what you need to know. Typically one-way communication may lead to memorization without a deep understanding, can result in surface level understanding, and lacks collaborative elements. How can you use both Bloom's taxonomy and the key differences between active learning and passive learning in tandem in order to prove the differences between thinking and critical thinking? All right, so going over thinking versus critical thinking. Thinking is shallow. Not much going on there. Critical thinking means that you have applied depth to the issue, the question, the problem, creating additional assumptions. So shallow is thinking, deep is critical thinking. Thinking is very surface level. deep, it's critical thinking. You're going all in. Going all in. So an example of thinking, healthcare is expensive. Well, yeah, it is. But isn't that a very shallow statement? Now let's take healthcare is expensive and turn it into critical thinking. How do you critically think about the statement healthcare is expensive? It's what you do. You can apply by examining the issue, by narrowing it down, offering evidence, arguments, and outcomes. So let's take healthcare as expensive and turn it into critical thinking. Many people, particularly those with low incomes, lack access to necessary healthcare services due to high cost, lack of insurance, geographic barriers, or other factors. The evidence, you will always refer to the library database and you will search for scholarly journal articles that are able to provide you with evidence of the assumption that healthcare is expensive with all of its various components. Arguments. Well, there will always be a pro and there will always be a con. Arguments are not one-sided. It's an argument because there are two or more perspectives. So a pro argument would be universal healthcare systems can ensure access to care for all, but at the cost of potentially higher taxes and government control. The con would be government-run healthcare can lead to long wait times, reduced choice, and lower quality of care. Outcomes: unnecessary illness and death, increased healthcare costs, social and economic inequality. So healthcare is expensive, yes, but what are the outcomes of that? Unnecessary illness and death, increased healthcare costs, social and economic inequality. This is just a supplement. You're expected to do the thinking on your own. All right. Why critical thinking for people who strive to obtain a career in the healthcare industry? When you are working with patients, you will need to be able to anticipate their needs. You need to be able to recognize a change in their status. You need to be able to effectively communicate not only with the patients, but also their family, as well as other colleagues. Critical thinking is important in the healthcare industry in order to protect patients' personal preferences, safeguard them from harm, troubleshoot, especially in the emergency room, innovative improvements, as well as rapid response. You can see why critical thinking is important because anyone working in the healthcare industry in a clinical setting often needs to be able to think on their feet very quickly, very quickly. The scientific knowledge is there, but now it's time to act, and that's where the critical thinking comes in. That's all, folks. I hope that you found this relatable and meaningful. I hope you enjoyed my presentation. This presentation, in case you haven't already figured it out, is directly correlated both with your week 1 writing assignment as well as your initial post for the week 1 discussion forum. I hope you got that. Toodles, excuse me. Hope you have a wonderful day. Professor Tammy out.